Good morning. Welcome to the Community Voice. I'm Steve Graddick, your host. Thank you for joining us today. Community Voice brought to you by Tanner Health System and Oak Mountain Academy. I believe we have on the phone Dr. Laura Larson, Medical Director of Infection Prevention for Tanner Health System. Are you there, Dr. Larson?
I am. Good morning.
Good morning. As I normally do, quick bio. Dr. Larson, Medical Director of Infection Prevention for Tanner Health System. Board certified in both infectious diseases and internal medicine. Earned her medical degree from the Mercer University School of Medicine and completed her residency and fellowship at Shands Hospital at the University of Florida. And on American Board of Internal Medicine, Infectious Diseases, and also chairman of the Carroll County Board of Health. Good morning. Thank you for joining us. Before we get started, just kind of just a sober moment to reflect just for a few seconds. I don't know if you remember, I think it was about 12 years ago that you came into studio and we introduced you to our audience. Do you remember that?
I do. I think it was, believe it or not, more like, it was a little longer than that because I've been here since 2004 now.
Really?
But you may be right with the date. So.
Well, I remember when you came in for that first visit, the first interview, nobody knew what an infection disease was or why in the world Tanner would hire a physician for infectious diseases. And I thought, and now look at us. Everybody's an expert on infectious diseases. I think life turns some very unusual ways sometimes.
It does. It does.
Well, as we normally do, let's start out with the stats at Tanner Health System.
Sure. We're still running about 25% of our tests are testing positive, and that's our number for the last 14 days. The last 7 days is 24%, so we're hopeful that maybe that's, it's too early to tell, but we would like to see this start plateauing off. Our projected peak is mid-September. So that's a couple weeks away. I hope that's wrong and we actually start to trend down before then, but time will tell. So yesterday we had 97 people hospitalized, and so we're staying pretty high with our number of hospitalizations. We have 15 patients in COVID-19 in the ICU, and our total mortalities since July, or actually since February, since we're looking at our mortalities since the vaccination was available to the public, and that's actually since February because our first doses got into arms in January, and then early February was when people got second doses. So we've had 99 mortalities since then. And since July, we've had 50 mortalities. And the reason why we're looking at July is that's when we started seeing Delta variant emerge in Georgia. So we're looks like almost over half of our deaths this year since February are from July until now. And another number that people have been asking me, what about children? How many children are testing positive? And we've had, since last Monday, we've had 302 people under the age of 18 test positive. And other people have asked me also, do we have kids in the hospital with COVID? And we don't, that I am following at all. And my understanding is that they were that severe, they're usually sent to Scheller hospitals in Atlanta, but so far we're doing okay with that. So those are our current statistics.
And basically kids would be those that are under 12?
Under 18 is technically a child and adolescent.
Okay. I got several questions. I kind of want to start out, though. Are the patients you're seeing now, are they sicker than the ones earlier this year because of this variant, or how do they compare in terms of severity of disease?
They are sicker and they're younger. That's the thing that's worrisome. I'm taking care of several people in the ICU right now, and I'm looking at the ages, and they're ranging anywhere from 33 to 59. So this is very different because before we were taking care of people mostly over 65, or at least over half were. But right now, I don't have a patient that I'm seeing in the ICU that's over 60.
Well, is part of that because of, I would assume, that younger age groups were less likely to get vaccinated?
Well, currently, right now, none of our ICU patients in with COVID are vaccinated.
Okay. So that's a reasonable assumption that we're having younger patients because the younger age group was not as quick to get vaccinated.
And I think younger people are more social. I know my mom's gone back into hiding again with how many cases we're seeing, and she's just being more reclusive. And so I think the younger population doesn't tend to do that as much as the older population.
We had a news story this morning about Governor Kemp authorizing 2,500 National Guard troops to support hospitals in Georgia. Will we see any of those at Tanner?
I hope so, because we are dealing with nursing shortages all the time. So that would be a great gift for us to have something like that happen.
We've heard the term diversion. Has Tanner had to divert any patients to? You mentioned the younger kids, but any other patients having to be diverted?
Intermittently, yes. Over the last couple of weeks, the hospital that has been hit the hardest for us for diversion has been Villa Rica Hospital. Diversion is something that we go on and off of, and there are different grades of diversion. And so, I know that at one point in the last week, Villa Rica had to divert ambulances and everything, and normally we don't have to do that.
Is that still in place?
I don't know.
Don't know.
Off the top, I'm not in that group that talks about diversion, but I'm aware of it when I get the emails about it. So I don't have a current status on that.
Okay. All right.
But I don't think it is currently.
Yeah. How are the nurses doing? We hear a lot more now about the strain on nurses than we used to, and the need for more and more nurses to come on board.
Really across the board, I talk a lot with the nurses in the ICU, and especially right now we have COVID patients that are being housed in the emergency room, more so like we did before. And some of them are angry that people don't take this seriously and have no idea what's going on here. I've seen the meme on the internet about the house burning down and people just walking by it, and that's how a lot of them feel. But I still see them being very committed and taking care of people, and I don't see a lot of helplessness and sadness as much as before. Just kind of resilient and just wishing that people took it more seriously. And I understand, if you are reading in the news or social media that this is something that you have a 1% chance of dying from. I mean, we're seeing all of that 1%, and 1% of the U.S. population is a gigantic number. So it's a different perspective of looking at something that is 1%, although, up to 20% of people with COVID get hospitalized. But we're seeing the worst of the worst, so it's very, very hard for us to resolve taking care of somebody that we know is not going to make it when a vaccine could have prevented that. And I also am very wary of people feeling like vaccines are being shoved down their throat. But I'm sorry. I mean, 93% of people that are dying here are unvaccinated from COVID when they're dying of COVID. And I'm sorry that 90% plus of our hospitalizations are unvaccinated, but those are real numbers. We're not making that up. We have I have nothing to gain by falsifying numbers to scare somebody into vaccination. I want you to get it because I want you to live.
Well, when we come back from the break, I want to jump into talking about Pfizer and FDA approval and boosters. But before we take that break, you had mentioned that you were hoping that this would peak in the next few weeks. I remember hearing a story about England and the Delta variant. I only heard it, I think, one time, that it ran through England, although, 1/10 of the population or whatever, pretty quickly in a matter of weeks. Is there any comparison or any relation to what happened apparently in England regarding the Delta variant?
It's hard to say because, we know we started seeing it in July and we're already into September, so we're 2 months in. If we look at India, it took about 4 months to peak and go down. So
okay.
Hard to say.
Hard to say. All right, we'll come back and we'll talk about boosters and Pfizer and everything else more specifically with vaccines. But first, this word from our sponsors.
Health is a journey. It's making better choices, even when it's not easy. It's taking care of yourself and the people you love. At Tanner Health System, we're there for you with every step, with primary care, heart care, cancer care, women's care, orthopedics, surgical services, and so much more. We're dedicated to helping you live and feel your best. So let's get on that journey to health. You've got places to be for many years to come. Find us at tanner.org.
As a graduate of Oak Mountain Academy, I've found that my experience on the mountain prepared me beyond all expectations. As a junior at Auburn University, I approached my studies with great confidence thanks to what I learned at OMA. When I think back on my time on the mountain, I think of my teachers. Their genuine love and concern for me as a student was always evident, and now, as an adult, I still foster those relationships. I'm Carly Robinson, an Oak Mountain Academy alum. Visit oakmountain.us to see how you can offer your child an amazing opportunity to be a warrior.
Good morning. Welcome back to the Community Voice. I'm Steve Gradick, your host. It's a beautiful Tuesday. Dr. Laura Larson's with us by phone. We're also on Facebook Live, and we're already getting a bunch of questions, which we'll try to get to shortly, or I'll try to kind of navigate through them as we go. All right. Big news. Pfizer received apparently FDA approval for their vaccine, and then I heard a story this morning. The CDC had to approve it. So I am, as usual, very confused. What's the latest on Pfizer?
So it was FDA approved a week ago, and then so I think that what happened with CDC is that it's just their recommendation now that followed that.
Okay.
And that's all that really means. It's just essentially a backing of the FDA approval.
Well, staying on vaccines, so should that give those who have been skeptical about vaccines being, quote unquote, experimental, et cetera, should that give them more confidence with FDA approval, or is that just a bureaucratic step?
I hope it does, because you have to still go through a significant amount of approval to be FDA approved, particularly in the amount of time that it took. It's interesting because the approval was submitted earlier this year, I believe in May, and the average time of approval is 6 months. But there was a ton of pressure to approve it, and some more time was spent on it. But the thing about it is there have been over 1 billion vaccines given worldwide, and so I'm not surprised that it did get FDA approval. It's interesting, though, once it's been approved, people have now saying that it was too fast. So it's like you can't have it both ways. People want something to be approved and rushed. It's not getting approved, and then it's approved, and, well, that's too fast. But, yeah, I hope it gives people comfort. I'm a year out from my COVID vaccine now, and I really feel like it has, from seeing people getting hospitalized in ICU and dying, I think it's an incredible tool that we have to mitigate severe illness.
Well, sometimes I wonder, if we hadn't had, under the last administration, Project Warp Speed, if vaccines hadn't been available or certainly not as available as quickly, what life would have been like. I imagine it would have been even more horrific.
It would have been horrible, I think, without them.
Yeah.
I think that we've got that tool. So it's amazing what we can do in 2020 and 2021 with science that we weren't able to do, 50 years ago. We should be very thankful for that. Back
to England, didn't I don't even remember the name exactly, AstraZeneca or something like that, wasn't that removed from application?
For here, yes. I don't know which countries are still using it, but there were a lot of problems and side effects from it that kind of halted our interest in it, and we certainly have enough vaccine with the 3 that we have approved for the United States citizens. And, I talk about the Novavax vaccine, and I keep, hoping it comes out, because I think more people will be comfortable with that technology, because it's the traditional flu vaccine technology. But that company has gone for approval in countries that are more vaccine poor than the United States. So I had hoped that would have already been something that would have been submitted here for emergency use authorization, but it hasn't so far. Is
that company out of the Northeast?
Yes, it is.
Maryland, I think it is.
Yes.
Well, that's pretty exciting, too. But now, the J&J one-shot vaccine is somewhat different in terms of its methodology than the other two, correct?
Yes, it's an adenovirus vector.
Now, that some people would find that more attractive, correct?
Yeah, because it's a one and done situation, although it's probably going to be recommended that that one require a booster after the fact too. But to be fully vaccinated with J&J, it's a one time.
All right, so you said the booster word, so let's go for it. What's the latest on boosters, and who should get them, and when are they coming?
Well, the American College of Immunization Practice Advisory Group, ACIP, we call them, met yesterday from 10 o'clock to 4:30 in Atlanta. They are an advisory panel of vaccine experts and immunologists that tell the CDC what they recommend to do with vaccines. So we haven't gotten feedback from that meeting because it just finished at 4:30 yesterday. What was being discussed was whether or not to recommend booster shots at 6 months versus 8 months, and for most of us, we're well out of that time range. And we know that the current recommendation for boosters by CDC are for those who are immunocompromised. So people that are immunocompromised that have been previously vaccinated can get a third vaccine as soon as a month after their second vaccine. So we know that is in place right now. But for boosters, our medical staff is really, really, really wanting that to happen sooner than later. We hear from the federal government that probably will be September 20th. A lot of us are hoping that that date gets pushed closer for those of us who take care of patients with COVID to have that extra layer of protection with a booster. So we know that the boosters are probably going to be offered to everyone that wants them, but we'll probably roll them out at our hospital like we did before with vaccinating frontline workers that want the booster, and then going on to the elderly, and then on from there.
Now, the September, if that proves to be the date, it won't be age restrictive. Everybody will be eligible that's had the previous shots.
I think it's going to be. I haven't read that, and I saw something at one point that said 18 and above. I haven't seen anything about 12 and above yet, but I may be wrong. I haven't looked at that specifically.
Mm-hmm. Can we all conclude that the booster is safe?
It's already been studied, and especially in Israel has been boosting thousands and thousands of people already, and what they actually saw was good safety data and a reduction in people getting hospitalized over 60, because that's where a lot of this information came from in the studies with that. They started to see breakthrough in cases because they had a large percentage of their population vaccinated, particularly people over 60. Then they were seeing breakthrough cases, and then revaccinated people over 60, and they saw the breakthrough cases go down.
Many elderly, of course, get flu shots. That should not, or should it? Is it okay to take them at the same time, or would you stagger them out?
The CDC came out and said that you can get them at the same time. I personally would not want to do that to me, and I'll tell you why. If I'm going to react, I want to know which shot I reacted to. Mm-hmm. So vaccine reactions happen. My daughter has significant flu vaccine reactions every year. We finally found a vaccine that doesn't cause her as much swelling and arm pain and fever and all that good stuff that happens with some people with vaccination. But I personally would get the booster first if it was available to me, and wait at least 2 weeks until getting the next vaccine. But I do want to mention that we're seeing flu in Georgia now, and that's something that a lot of people are not really aware of, and I can talk about that if you'd like.
Well, I do, and let me ask you in this way, because I've been thinking about this. We use the term for COVID vaccine, but for flu, we just simply call it a flu shot, but yet they're one and the same, or are they not one and the same? And if they are one and the same, why don't we use the same terminology for both? Well,
in the medical field, we use influenza vaccine, the technical term. I think it's just been colloquialized to flu shot. I've heard lots of the COVID jabs, that kind of thing. People have I think that it's in the common, outside the medical field in layman's terms, we call, the pneumonia shot. We call the flu shot. Shingles vaccine. A lot of people use shingles vaccine. I just think it just hasn't gotten to be more commonplace in layman's terms.
Quick programming note, we've got archived on the website and on the Facebook page 2 previous programs with Dr. Larson, so Colin and I are trying to ask a little bit different questions as we go forward. And I know one question Colin asked was regarding natural immunity, and since that time, I understand there's an Israeli study of 76,000 people that show that natural immunity is broader based and quote unquote better than the shots. Have you seen that? Do you have an opinion on that?
I do think that natural immunity provides protection. We're trying to pull of our hospitalizations how many people had COVID before, but that's a really hard thing to pull because not everyone was tested here. We can pull how many people are vaccinated because it's entered into the GRITS, the Georgia registry. So we know exactly how many Alabama residents, Georgia residents were vaccinated because that's easy information to pull. But I do think having prior COVID offers some protection. We just don't know how much. And what I'd like to find out, in going through all of our data is how many people, I know of at least 6 people, just because we were keeping closer track of reinfections last year, have had COVID before. I know that number's higher. It's just a hard number to capture because some people had it, got tested, at CVS or somewhere else, and then they come in and they test here and get admitted. So there's no good way to capture that accurately, but we're trying because I do think there is some protection. Now, whether or not it's better than the vaccine, it's hard to say because I know that people that probably had a really severe case have more than adequate protection, more than likely, but people that have had mild illness may not have protection. So it's kind of across the board. It's hard. It's a hard thing to capture. But I do think having had COVID is at least somewhat protective for sure. Again, coronaviruses are weird in the sense that they can mutate and become different, and kind of like the flu does every year, where we have new strains come out. That's what we have happen. I think this is going to end up being a lot like a new flu, but a different virus.
Our guest this morning is Dr. Laura Larson. We got a lot of questions on the Facebook page. I'm just trying to hit them in general terms for the sake of time. When we come back, we'll talk about Regeneron and prophylactics, etc. But first, this word from our sponsors.
Health is a journey. It's making better choices, even when it's not easy. It's taking care of yourself and the people you love. At Tanner Health System, we're there for you with every step, with primary care, heart care, cancer care, women's care, orthopedics, surgical services, and so much more. We're dedicated to helping you live and feel your best. So let's get on that journey to health. You've got places to be for many years to come. Find us at tanner.org.
At Oak Mountain Academy, our daily schedule includes convocation, prayer, and the Pledge of Allegiance. By doing so, we build a family-like community where all students grow and flourish and personal faith is encouraged. Through community service and a historical approach to biblical study, our students are taught the value of the warrior way, honesty, respect, and responsibility. Oak Mountain Academy. We are a family creating legacies. To learn more, visit oakmountain.us.
Good morning. Welcome back to the Community Voice. Dr. Laura Larson, Medical Director of Infection Prevention for Tanner Health, is on the phone. Susan Avery, Bob Uglum, and myself, as a matter of fact, are interested about Regeneron, monoclonal antibodies. Who's a candidate for it? It's early treatment, prescribed, and apparently very effective a treatment, but not everybody's eligible. Is that correct?
A lot of us are eligible because one of the criteria on there that hits a lot of us is a body mass index over 25, and so that's actually just barely overweight, which makes people eligible. But there is a huge list of risk factors for progression to severe disease, and that is if you look at I need to have this. I can find out where we can publish this on one of our sites. But if you look up the emergency use authorization of Regen-COVID for healthcare workers, and on pages 3 and 4 of that document that's incredibly long, over 20-something pages, but pages 3 and 4 have the specific populations that are at high risk for progression to severe disease. And so those are the people that are eligible. The other thing that's really important is it needs to be given within 10 days of the onset of symptoms because it's not effective as much after that period of time. So we're giving it. There are also several clinics in the community that are giving it as well. And I'm very happy that clinics outside of Tanner are giving it because it's a effective therapy that I think really we're going to end up having more people wanting it than anybody can give. And I really, really, really think it's important for people to hear that I think it's a very effective therapy, much more effective than a lot of the oral agents that have not been necessarily borne out to be as effective as we would like for them to be. So the monoclonal antibody is available in the community, and I would highly encourage people that are at risk for progression of severe disease to get it. And it's a lot of people that, diabetes, heart disease, congestive heart failure, obesity. It's a long list of and most people qualify.
If someone's been vaccinated, is a Regeneron called for?
If you're high risk, like I have had a couple of patients that are extremely high risk due to being obese, congestive heart failure, or obese with asthma, or obese with, and obesity always seems to be a big factor for us for not doing well and hard to ventilate. So I do recommend it after vaccination if a person does get sick with COVID, and I'm worried about them progressing to severe COVID.
Well, we hear about the Southeast having a very high obesity rate. How high is it regionally or locally, and what kind of challenges? How do you define it? I mean, who is obese and who isn't?
Well, obesity is defined as a body mass index over 30. And so that is, and 30, you get into severe obesity and morbid obesity, although those terms have been changed, but it's your body mass index. And that's something that's easy for you to calculate. So you put in your height and your weight in it, and then that is a number that's given. 25 is a normal BMI. Less than 25 is underweight. Or less than 25, 20 to 25 is normal. 25 to 30 is overweight, and then over 30 is obese.
Prophylactics, what's the current word on hydroxychloroquine? And now ivermectin is not a prophylactic necessarily, is it?
Some people are using it as that. But I as I am sitting here on August 31st, 2021, there are it is not proven to be effective across the board that we are aware of. I know there's a lot of information last year on ivermectin in smaller studies and hydroxychloroquine in smaller studies, but a year later, we still don't have enough data to show that those work in every case. And we are starting to see people admitted with ivermectin toxicity, and some people are taking it on their own from veterinary use, which we don't recommend. We just don't have enough studies that show that it's an effective prophylactic or effective treatment, and we are starting to see people admitted that took it and are still admitted and going to the ICU. So it's one of those things that, from the Infectious Diseases Society of America, we are not endorsing its use outside the context of a clinical trial because it's still being studied. I wish it worked. I wish that hydroxychloroquine worked last year. It did not. We used it, and we did not find efficacy. So I think the jury is unfortunately still out for ivermectin too. And I would just caution people about buying it over the counter and taking it because, again, we're seeing people getting sick from it. And the CDC sent out a health advisory that there are more calls to poison control in the United States due to ivermectin toxicity than we've seen. So it's something you have to be very careful with.
We've got one question posted to Facebook, which has been a question from the very beginning. What about pregnant women? Are the vaccines, what has been determined in terms of safety as regards to pregnancy?
So we have enough data now to recommend it in pregnancy, absolutely. And you probably saw there's been several news reports of pregnant women dying recently from COVID and losing their children. So we do recommend it being given to pregnant women now. We have enough information.
I think people I talk to have been vaccinated. I think the concern that I've heard is basically, well, what about 2, 3, 4, 5, 10 years down the road? We don't know. Is that a reasonable question?
I think it's a reasonable concern that people have, but we know that vaccines work by getting in and getting out, and it's your immunity that lasts. So, what the vaccines code for is a protein that we make immunity to. Our bodies do this all the time. We get scratched. Essentially, we're vaccinated. We get exposed to things all the time. So I really don't worry about long-lasting effects of these vaccinations because, number one, we're into our second year. I'm one of the early vaccine persons, and I really don't worry about that because I think we would have seen a lot more. With how many people have gotten it, I think we would have seen a lot more. And, time will tell. It's just one of those things. It's a risk-benefit analysis. With my age and my hypertension and my weight, I'm more at risk to go to progress to severe COVID. I'm much more worried about that than I am worried about what's, the potential risk down the line, which I don't think is significant. But I do have potential risk of being exposed to COVID and not doing well with it. So it's for, I tell people, weigh it out. It's a risk benefit for you. But the thing that's alarming, again, right now is we're seeing a lot of very young sick people, and that was different from what's before.
We don't say this enough, Dr. Larson. Thank you for coming on the show on a regular basis.
Thank you.
We appreciate it, and I know our audience does. And we salute you and all your coworkers and colleagues, and particularly the nurses. And we hope to continue to do this show on a regular basis to provide some real education to our local folks. And again, thank you.
Thank you.
And everyone go out and make it a great day. You're in tune to WLBB Carrollton.